Ladies and gentlemen, thank you for joining me today. As a urologist, I want to bring forward a topic that many older men rarely discuss openly, yet it deeply affects their physical health, mental well-being, hormone balance, and even their long-term quality of life. After the age of 60, the male body undergoes profound changes: declining testosterone, reduced tissue elasticity, slower blood circulation, weaker pelvic floor muscles, and a more sensitive prostate. These changes don't mean a man must give up intimacy or pleasure, but they do mean he must approach sexual habits with more awareness, more gentleness, and more understanding of his biology. Today, I want to highlight 7 common masturbation mistakes that many men over 60 unintentionally make. Habits that gradually, silently, and sometimes permanently harm their sexual and urinary health. My goal is simple: to help older men continue living with confidence, vitality, and comfort, without discomfort, embarrassment, or preventable complications. After the age of 60, one of the most important shifts a man must recognize is how dramatically the tissues of the penis change. Throughout youth and middle age, the skin is naturally elastic, well lubricated, thick, and resilient. Nerve endings fire rapidly, blood vessels respond instantly, and even rough or hurried stimulation rarely causes noticeable damage. But as men grow older, the cumulative effects of hormonal decline, reduced collagen production, slower circulation, and natural cellular aging begin to reshape the landscape of sexual health. This is not a weakness, it is simply physiology. And learning to adapt to these changes is the difference between sustaining pleasure or unintentionally harming yourself over time. After 60, the skin becomes thinner and drier, making it much more vulnerable to friction. The nerve endings are also more sensitive to overstimulation and irritation. Even the erectile tissue itself, corpora cavernosa and corpus spongiosum, receives slightly diminished blood flow, making it slower to respond and less tolerant of repeated pressure. Many older men continue using the same intensity, speed, or grip strength they used decades earlier, not realizing that what once felt normal may now be creating micro-tears, nerve irritation, or inflammation. These micro-injuries often don't cause immediate pain, which is why so many men remain unaware of the damage. But over time, the subtle trauma accumulates, contributing to long-term sensitivity loss, decreased responsiveness, and even erectile instability. What I want men to understand is that gentle stimulation is not a downgrade. It is actually the correct biological approach for an aging body. Think of the penile tissue like the skin under your eyes or the delicate areas of your face. It requires respect, warmth, softness, and patience. When stimulation is slow, mindful, and lightly pressured, the blood vessels dilate fully, the nerves respond more clearly, and the entire system functions optimally. Instead of forcing arousal through intensity, older men benefit from coaxing arousal through comfort, warmth, and sensory awareness. This shift not only protects the tissue, but often enhances pleasure because the body can fully participate without bracing against irritation or strain. Another factor to consider is healing time. In younger years, the skin and nerves repair quickly, sometimes overnight. But after 60, healing slows significantly. Small irritations that once disappeared in hours now take days or even weeks. If a man unknowingly injures himself again before the tissue has recovered, the damage becomes cyclical, leading to chronic dryness, reduced sensitivity, persistent soreness, or inconsistent erectile quality. These issues can be prevented simply by adjusting technique, pace, and pressure. Taking more time also benefits the psychological and hormonal side of male sexuality. When a man slows down, his parasympathetic nervous system, the rest and restore system, activates. This promotes relaxation, better blood flow, steadier erections, and more satisfying release. In contrast, fast or forceful stimulation triggers the sympathetic nervous system, which prioritizes speed over quality and can lead to weaker erections or quicker completion. Embracing gentleness is not about age-diminishing pleasure. It is about understanding how the body evolves and learning to work with it rather than against it. When older men honor the new sensitivity and fragility of their tissue, they often experience deeper comfort, improved function, and a more connected relationship with their own sexual well-being. One of the most overlooked aspects of sexual health after the age of 60 is lubrication. Many older men underestimate how profoundly hormonal shifts influence moisture levels, skin flexibility, and friction tolerance. Throughout youth and middle adulthood, the penis naturally maintains a certain level of surface moisture due to healthy testosterone levels, supple skin, and efficient sebaceous gland function. But with age, testosterone gradually declines, collagen production slows, and the skin's ability to retain hydration diminishes. This results in dryness that can make even normal friction feel harsher than it once did, even if a man doesn't consciously perceive it during the moment. What happens internally is just as important. The skin becomes thinner and more delicate, while the underlying tissues lose some of their natural cushioning. Without sufficient lubrication, every stroke generates more resistance, and that resistance translates directly into micro-damage. These are tiny abrasions, small enough to be invisible but significant enough to cause irritation, redness, swelling, or a burning sensation later. Many older men ignore these symptoms or assume they are random discomforts, not realizing that they arise from insufficient moisture during stimulation. The problem compounds because healing slows with age. A younger man's skin might recover overnight from friction irritation, but older skin repairs itself more gradually. When dryness continues session after session, the tissue does not get the chance to fully recover, leading to chronic sensitivity, reduced pleasure, and sometimes even tiny cracks in the skin that invite infection or inflammation. This persistent irritation can make the penis feel tender or numb, causing a man to apply even more pressure next time, unknowingly worsening the cycle. Lubrication is not simply about comfort, it is about protection. A high-quality lubricant creates a smooth barrier that reduces friction dramatically, allowing the skin and underlying tissues to glide instead of resist. This single change can protect nerve endings, preserve long-term sensitivity, and reduce the risk of swelling or post-activity soreness. For older men, this difference is often transformative. Choosing the right type of lubricant also matters. Some men find water-based lubricants ideal because they are gentle, easy to wash off, and compatible with sensitive skin. They provide smoothness without heaviness, making them excellent for shorter or lighter sessions. Others prefer silicone-based lubricants, which last significantly longer and remain silky even with extended stimulation. Silicone tends to be more comfortable for men who experience pronounced dryness or who need sustained moisture without frequent reapplication. Oil-based lubricants can be soothing, but may irritate sensitive skin or interfere with certain materials, so they require caution. Temperature also influences comfort. Older skin responds better to warmth, so gently warming the lubricant in the hands before use enhances blood flow and minimizes shock to delicate tissue. This simple step helps older men relax more fully, producing a more natural, responsive sensation. The key is not to view lubrication as something optional or extra, but as a necessary part of responsible self-care after 60. It preserves sensitivity, enhances pleasure, prevents micro-injuries, and supports long-term sexual health. When a man embraces lubrication as a normal, essential tool, he protects his body and ensures that intimacy, whether with himself or a partner, remains comfortable, safe, and deeply satisfying. As men age, the prostate naturally becomes more sensitive, more reactive, and more prone to inflammation. By the time a man reaches 60, his prostate has undergone decades of hormonal influence, cellular growth, and gradual enlargement. This enlargement is a normal part of aging, not a disease, but it does mean that the prostate becomes more easily irritated. Many older men do not realize that certain masturbation habits, especially those involving forceful pressure, prolonged stimulation, or vigorous techniques, can overstimulate the prostate without their awareness. This overstimulation may not cause immediate pain, which makes it even more deceptive, but it can trigger subtle inflammation that builds over time. The prostate is not just a passive gland, it is a delicate and highly vascular structure surrounded by sensitive nerves. When stimulated gently and intentionally, it can contribute positively to sexual pleasure and overall well-being. But when exposed to repeated or excessive pressure, the gland can swell temporarily, just like any inflamed tissue. For younger men, this swelling tends to resolve quickly. However, for men over 60, the prostate responds more slowly, and the tissue around it is less forgiving. Even mild overstimulation can lead to urinary frequency, pelvic heaviness, discomfort during sitting, or a lingering sensation of pressure in the lower abdomen. Many older men do not connect these symptoms to masturbation habits. They may assume the discomfort is due to age, bladder issues, or unrelated health concerns. But what they are experiencing is often a form of low-grade prostatitis, an inflammation triggered by repeated irritation. Because the prostate sits at the junction of urinary and reproductive pathways, any swelling affects both systems. A man may notice a slower urine stream, post-urination dribbling, or a feeling of incomplete emptying. He may also notice that erections feel different or that his pelvic floor muscles tighten involuntarily, creating a cycle of discomfort. Older men are also more vulnerable to congestion in the prostate. When arousal is prolonged without completion, or when stimulation is intense but the body is not fully relaxed, blood can pool around the gland. This congestion contributes to tenderness and swelling. The key is balance, avoiding excessive duration, avoiding aggressive pressure, and ensuring that the pelvic muscles stay relaxed rather than tense. Gentleness is essential. Slow, mindful stimulation minimizes the risk of irritating the gland. When the pelvic floor remains relaxed, the prostate drains more effectively, reducing the likelihood of buildup or congestion. Warmth, comfort, and calm breathing help the body stay in the parasympathetic state, which supports healthy function of the prostate and reduces inflammation. Understanding the prostate's aging process allows men to adjust their habits proactively. Instead of forcing intensity, they can prioritize comfort and awareness. If a man notices even mild pelvic tightness or urinary changes after masturbation, it is a sign that his prostate needs a gentler approach, or perhaps a period of rest. With thoughtful adjustments, older men can protect their prostate, improve their urinary health, maintain stronger erections, and continue enjoying pleasure without discomfort or silent damage building over time. One of the most significant yet unrecognized changes that occurs in male sexuality after the age of 60 involves blood flow. Healthy erections, pleasurable sensation, and comfortable stimulation all rely on robust circulation. But as men age, arterial elasticity decreases, endothelial function weakens, and microvascular blood flow becomes less efficient. This doesn't mean a man loses his capacity for pleasure, far from it, but it does mean the penis becomes more sensitive to pressure that restricts blood movement. Unfortunately, many older men continue using techniques from their younger years that unintentionally constrict blood flow, especially tight gripping or squeezing. These habits may feel familiar, but they place strain on tissue, nerve pathways, and vascular structures that are no longer as resilient as they once were. When a man uses excessive pressure during masturbation, he compresses the small arteries that supply blood to the erectile tissue. These vessels, especially the cavernous and dorsal arteries, are responsible for delivering oxygen-rich blood to maintain firmness and nourish nerve endings. In younger bodies, increased pressure may cause only minor temporary constriction. But after 60, when circulation is already slower, squeezing or gripping too tightly can significantly reduce oxygenation. Over time, this restricts the health of the erectile tissue itself and may contribute to weaker rigidity, slower arousal, and longer recovery time after stimulation. Older erectile tissue does not tolerate reduced oxygen well. When blood flow is blocked even briefly, the penis can experience what is essentially a mild form of ischemia, a state where tissue receives less oxygen than it needs. Repeated episodes of poor oxygenation can weaken the smooth muscle fibers responsible for strong erections. This is one of the silent reasons why many older men notice inconsistency in firmness, even when desire is still strong. They often assume the problem is hormonal or emotional, not realizing their technique is influencing vascular performance. Another consequence of restricted blood flow is nerve sensitivity changes. The nerves that provide sexual pleasure are extremely dependent on good circulation. When blood is restricted, these nerves can become overstimulated, fatigued, or even temporarily desensitized. This is why some older men experience tingling, numbness, or a dull sensation afterward. With too much pressure, the body is essentially fighting against itself, trying to feel pleasure while restricting the very circulation that supports it. Older men also tend to hold tension in their pelvic muscles, especially when using forceful or fast techniques. This pelvic floor tightening further impedes blood flow, creating a cycle of reduced oxygen, reduced sensation, and increased strain. To break this cycle, it is crucial to use techniques that promote circulation instead of hindering it. Gentler stimulation allows the blood vessels to remain open and responsive. Slow, rhythmic movement encourages full engorgement without stress on the tissue. Warmth enhances vasodilation, improving oxygen delivery. Relaxed breathing and a calm mind activate the parasympathetic nervous system, which is essential for healthy erections. These small changes dramatically improve blood flow, leading to stronger, more comfortable, and more sustainable sexual function. The goal for older men is not to stop self-pleasure, but to evolve with their bodies. By avoiding intense grip pressure and choosing methods that support natural circulation, men over 60 can protect their erectile health, maintain better long-term function, and enhance overall enjoyment. Working with the body rather than against it preserves vitality and prevents the silent damage that tightness and constriction can create over time. One of the most common patterns I observe in older men is the habit of rushing through stimulation, often without realizing it. This rushed style usually began in adolescence, when privacy was limited, urgency was constant, and speed felt necessary. Over the decades, the brain wires itself to associate sexual stimulation with tension, fast movements, and a hurried finish. While this may have worked in earlier years, the male body after 60 is no longer built for that intensity. A rushed approach strains muscles, reduces blood flow, overwhelms nerve pathways, and ultimately diminishes pleasure rather than enhancing it. As men age, the nervous system becomes more sensitive to stress. Rapid or tense stimulation activates the sympathetic nervous system, the same system responsible for the fight-or-flight response. When this system is active, blood flow to the pelvis decreases, the pelvic floor tightens, and the body becomes less responsive to arousal. Older men often interpret this as declining libido or weaker erections, but the real issue is that their pace is out of sync with their biology. The body needs slowness and relaxation, not the tension and urgency of youthful habits. Rushed masturbation also leads to inconsistent arousal. When the brain is pushed into a quick release pattern, the experience becomes mechanical rather than sensory. Instead of allowing sensation to build gradually through the skin, nerves, and pelvis, the body jumps ahead, missing the deeper waves of pleasure that come only with time and patience. Over years, this pattern can dull sensitivity, making arousal feel muted. Many older men try to compensate by increasing pressure or speed, unknowingly worsening the cycle. Muscle strain is another important factor. Fast, tense motion causes the pelvic floor to contract repeatedly. In a younger man, these muscles recover quickly. After 60, they fatigue easily, and prolonged tension can lead to aching in the groin, lower back discomfort, or a sensation of heaviness. This same pelvic tension can also contribute to premature release or difficulty reaching climax, which surprises many older men. They believe they are losing control, when in reality, it is their long-trained habit of rushing that is disrupting the natural sequence of arousal. Slowing down fundamentally shifts the sexual experience. When stimulation becomes intentional rather than hurried, the parasympathetic nervous system, responsible for rest, pleasure, and healthy erections, activates fully. Blood circulates more freely into the erectile tissue, sensitivity increases, and the body becomes more attuned to subtle sensations. What once felt weak or inconsistent often becomes fuller and more pleasurable simply because the pace matches the body's needs. Taking time also enhances emotional presence. When older men slow down, they reconnect with their bodies, noticing textures, warmth, and rhythms they may have overlooked for decades. This deeper awareness not only improves physical function, but can also support better mental clarity, reduced anxiety, and greater satisfaction. Rushing is not a sign of desire, it is a remnant of old conditioning. The male body after 60 thrives on spaciousness, deliberate movement, and relaxed breathing. By letting go of the urge to hurry, older men unlock a richer, safer, and far more fulfilling sexual experience. The body rewards patience with improved function, stronger erections, and deeper comfort, turning self-pleasure into nourishment rather than strain. Excessive pornography use is one of the most frequently overlooked factors affecting sexual wellness in men over 60. While porn itself is not inherently harmful, the way the aging brain responds to digital stimulation becomes very different from how it did decades earlier. As men get older, dopamine pathways, the circuits responsible for motivation, reward, pleasure, and sexual desire, naturally become more sensitive to overstimulation. This means that what once felt exciting or mildly stimulating can become overwhelming to an older nervous system. The repeated exposure to fast-paced, high-intensity, constantly changing imagery can desensitize the brain's natural reward response and make real, physical stimulation feel less engaging or less pleasurable. The brain adapts to whatever it experiences frequently. When a man repeatedly uses pornography as his primary source of stimulation, his neural circuits begin to expect the novelty, speed, and intensity of digital arousal. These patterns train the brain to associate pleasure with the screen instead of with natural sensory input. Over time, this can dull responsiveness to touch, reduce sensitivity, and make arousal during self-stimulation or partnered intimacy more difficult. It is not a failure of the body. It is simply the result of conditioning. For older men, the consequences of this conditioning are often more pronounced because the aging nervous system recovers more slowly. Excessive porn use can lower natural libido, create difficulty maintaining erections, increase performance anxiety, or cause a sense of mental disconnection during arousal. Many men describe feeling physically stimulated but mentally distracted, or mentally interested but physically unresponsive. This disconnect is a classic sign of dopamine fatigue, a condition in which the reward system becomes less responsive due to repeated overstimulation. Another challenge is pacing. Porn encourages fast, urgent stimulation, which contradicts what the older male body needs: slowness, relaxation, and steady arousal. This mismatch between visual intensity and physical requirement can create tension in the pelvic floor, disrupt erection quality, and lead to inconsistent or unsatisfying release. Many older men mistakenly interpret these changes as a decline in sexual ability, when the true culprit is overstimulation of the brain rather than decline of the body. Emotional health is also affected. Overuse of pornography can contribute to anxiety, irritability, insomnia, and reduced emotional satisfaction. The dopamine spikes from excessive viewing become harder for the brain to regulate, leading to a cycle in which more intense or frequent content is needed to achieve the same level of excitement. This cycle can leave men feeling depleted, mentally foggy, or less motivated in other aspects of life. However, the situation can be improved with simple, intentional changes. Reducing pornography consumption allows dopamine receptors to reset, restoring natural sensitivity. Many older men notice improvements in erection strength, libido, mental clarity, and emotional well-being within weeks of lowering exposure. Reconnecting with real sensory stimulation, touch, warmth, rhythm, sound, breath, brings the body back into alignment with the mind. When the brain no longer relies on digital intensity, it becomes easier to feel pleasure from natural physical experience. Moderation is the key, not abstinence unless a man chooses it. Being mindful of frequency, avoiding escalating content, and allowing the nervous system ample time to recover can protect sexual health and enhance fulfillment. The goal is not to judge or restrict, but to support the aging brain in functioning optimally. By respecting the limits of dopamine pathways, men over 60 can preserve their sensitivity, strengthen their arousal response, and cultivate a healthier, more balanced relationship with their sexuality.